A simple daily drink for sciatica, back discomfort, and head relief. When people hear the words herniated disc, the first reaction is usually fear. They imagine operating rooms, metal screws, long recovery times, and the possibility that their pain may never fully go away. And because of that fear, thousands of people rush into surgery long before they ever needed it. But here's the truth I always tell my patients. Your spine is far more capable of healing on its own than most people realize. A herniated disc is not a death sentence for your back. In fact, the majority of cases improve without any surgical intervention at all. The body has an incredible ability to pull that disc material back into place and calm the irritated nerve, especially when you give it the right conditions to heal. The problem is that many clinics push surgery as the fast fix, even though it often brings unnecessary risk, expense, and downtime. What most people never hear is that your disc naturally shrinks, reabsorbs, and heals over time, and this happens quietly inside your body without any hospital visit. Studies have shown this again and again. With proper conservative care, hydration, targeted exercises, rest from the wrong movements, people recover just as well, sometimes even better, than those who undergo surgery. That's why I always slow people down before making a drastic decision. Unless you're losing strength in your legs or experiencing a severe neurological emergency, surgery should almost never be the first choice. Your body was designed to repair itself. Your spine was built to recover. And most people, once they understand this, feel a wave of relief because they finally realize, I'm not broken, I just need to heal the right way. This is the mindset I want you to start with before we talk about treatment, hydration, or exercises. When you understand that your spine can bounce back naturally, everything else becomes a whole lot easier. Why herniated discs happen? Most people think herniated discs happen only because of lifting something heavy, twisting wrong, or a sudden injury. But the real root cause is much quieter, and it affects almost every adult over 40. Chronic dehydration inside the spine. Your spinal discs work like soft, water-filled cushions placed between each vertebra. Think of them as tiny shock absorbers. When they're full of water, they stay thick, flexible, and strong. They help you bend, twist, walk, and sit without pain. But here's the part that surprises most people. Nearly 80% of a healthy disc is made of water. So what happens as the years go by? We drink less water. We move less. Caffeine, stress, late nights, certain medications, all of these quietly drain water from the body. As those discs lose moisture, they begin to shrink and flatten. A dehydrated disc becomes stiff, brittle, and more likely to crack or bulge out of place. And once it bulges, it presses on nearby nerves. That's when the classic symptoms appear: radiating leg pain, numbness, tingling, heaviness, or weakness. The scary part? You don't feel dehydration happening. It develops slowly, sometimes over years, until one day the disc can no longer handle the pressure. On MRI scans, the difference is crystal clear. Hydrated discs show up bright white, full of fluid, healthy, and plump. Dehydrated discs look darker and flatter, almost like dried fruit compared to fresh fruit. This is why herniated discs are so common today. It's not just age. It's not just lifting something heavy. It's the long-term drying out of a structure that was designed to live in water. The good news? Just like a dried sponge comes back to life when you soak it, your discs can rehydrate when you give your body the proper hydration, minerals, and movement. Rehydration is not a quick fix, but it is one of the most powerful natural ways to help your spine heal from the inside out. Understanding this hidden cause is the first step in reversing the problem, without rushing into surgery or expensive treatments. The simple drink that helps rehydrate your spine. If you've been struggling with back pain, nerve pain, or a herniated disc, the solution might be far simpler than you ever imagined. Before expensive treatments, injections, or surgery, your spine needs one basic thing: hydration at the cellular level. And there is one easy drink that helps your discs pull water back in: Mineralized water with natural, unrefined salt. Most people have been told to drink more water, but plain water alone often isn't enough. When your body is low on minerals like sodium, magnesium, and potassium, water doesn't enter your cells effectively. It simply passes through you. That's why many people drink water all day and still feel fatigued, dizzy, or stiff. Their cells are still dehydrated. Natural, unrefined salt changes this. This special salt still contains trace minerals that act like tiny water magnets. When you mix a pinch of it with clean water, it helps your body absorb water more efficiently, sending hydration deeper into your tissues, including the discs in your spine. Why this drink helps your discs. Heal your discs are like water balloons with a tough outer layer and a soft gel-like center. When they're dehydrated, they collapse, crack, and begin pressing on the nerves. But when they rehydrate, they regain their shape, reduce pressure on the nerves, and support smoother movement. Mineralized water helps replenish electrolytes that your discs depend on, improve fluid balance inside every cell, reduce inflammation and muscle cramps, support nerve communication, relieve headaches and fatigue, improve digestion and metabolism. This simple drink has helped thousands of people naturally reduce pain and stiffness, not because it's magic, but because it restores what your spine has been missing for years. How to make it. 1 glass, 250 milliliters of clean water. A pinch of pure, unrefined salt, sea salt or rock salt. Mix well. Drink it first thing in the morning on an empty stomach. That first morning glass is all you need to switch on deep hydration. The rest of your daily water can be plain. Just make sure you reach about 2.5 liters per day depending on your size and activity level. If you use a clay water filter at home, the benefits are even greater because the water is cleaner and free from chemicals like chlorine and fluoride, which can interfere with hydration. Why doctors rarely mention this? Because it costs almost nothing. No prescription, no product to sell, just water and natural salt. But for someone with herniated discs, sciatica, or chronic pain, this simple, inexpensive habit can be the first step toward rehydrating the spine and allowing your discs to heal naturally again. Your body is designed to recover. The right hydration simply gives it the support it needs to start. The exercise that immediately relieves sciatic pain. When the sciatic nerve gets irritated by a herniated disc, the pain can feel sharp, burning, or electric, shooting down your legs, into your calves, or even into your feet. It can make simple things like standing, walking, or getting out of bed feel impossible. But there's one targeted movement that brings fast, gentle relief for most people, a controlled back extension exercise designed to decompress the irritated nerve. This isn't stretching. It's not yoga, and it's not about strength. It's a movement that helps guide the disc material away from the nerve, giving your body a chance to calm the inflammation and restore normal function. Step 1. If the pain is intense. Start by lying on your stomach on a bed mat or soft surface. Place 1 or 2 pillows under your chest to slightly elevate your upper body. Stay here for 5 minutes. This position gently reduces pressure on the nerve and allows the spine to settle. Many people feel their leg pain begin to fade within minutes. Step 2. The gentle elbow support. If your pain isn't severe, or once step 1 becomes comfortable, move to this phase. Prop yourself up on your elbows, keeping your hips, pelvis, and legs completely relaxed on the floor. Hold this position for several breaths. You should notice the pain in your legs start to pull back towards your lower back. This is a good sign. It means the nerve is calming down. Step 3. The full extension press. If your pain does not worsen in step 2, add this progression. 1. Place your hands under your shoulders. 2. Slowly straighten your elbows. 3. Lift your chest upward. 4. Keep your hips and pelvis firmly on the floor. This is the classic extension press, and it helps move pressure away from the nerve root. Perform 5 to 20 repetitions, once or twice per day. What you should feel, most people notice. Less leg pain, less numbness or tingling, relief in the calves or back of the thighs, a cooling or easing sensation around the nerve. Within the first week, the exercise becomes easier and the pain tends to decrease steadily. How to progress safely. As it becomes more comfortable, you can gradually lift your chest higher for greater relief, but never lift your hips off the floor. The goal is to create a gentle backward curve, not a full body push-up. This deeper extension helps reposition the disc more effectively and often speeds up healing. Why this works. Think of your disc like a soft cushion. When the cushion bulges backward and touches the nerve, you feel pain. This extension movement creates a mild vacuum effect inside the disc, encouraging it to slide back toward the center, away from the nerve. It's one of the most researched, reliable first aid movements for sciatica caused by disc herniation. Your body signals to stop immediately. You must stop the exercise if your leg pain gets worse, you feel new numbness, you feel sharp pain instead of gentle pressure, your symptoms spread further down your leg. If that happens, return to step 1 or rest. The biggest mistakes to avoid: expanded. When people try to treat sciatica or a herniated disc on their own, they often make mistakes that actually worsen the condition. These errors are extremely common, even in gyms and physical therapy settings, but avoiding them can speed up your recovery and protect your spine for years. Mistake number 1, turning the exercise into a push-up. Many people think the extension exercise is just a modified push-up. It's not. When you lift your whole body off the floor, your spine stays straight instead of forming the gentle backward curve it needs. Without that curve, the disc doesn't move away from the nerve, and the pain stays exactly where it is. Correct way: let your hips, pelvis, and legs stay fully on the ground while only your chest rises. Mistake number 2, bending forward, flexion exercises. This is the most dangerous mistake for anyone with a herniated disc. Forward bends, toe touches, sit-ups, crunches, stretching the hamstrings. Push the disc backward, directly into the nerve. It's like squeezing a water balloon from the front. The pressure shoots out the back. This is why so many people feel worse after trying to stretch out the pain. If you have a herniated disc or sciatica, never do forward bending exercises until your spine has healed. Mistake number 3, doing back extension, benches at the gym. Just because the machine is called the lower back bench doesn't mean it's safe. These benches force your spine to bend forward repeatedly, which increases disc pressure and can worsen the herniation. Many trainers recommend them without understanding spinal mechanics. If you have disc issues, skip these machines entirely. Mistake number 4, ignoring hydration and trying only stretches. Most people focus only on stretching or massaging the painful area, but if your discs are dehydrated, the problem is still there. Without restoring water and minerals inside the disc, the relief from stretches is short-lived. Real healing requires both: hydration with minerals, correct extension movements. One supports the other. Mistake number 5, stopping too soon. Sciatica often improves in stages. Symptoms may decrease in the legs before disappearing in the lower back. This is normal. Many people stop the exercises too early, right when the spine is just beginning to heal. Consistency is key. Here's the empowering truth: your spine is built to recover. A herniated disc may feel terrifying, but in most cases, it is not a life sentence, and it does not mean you need surgery. Your discs can rehydrate, your nerves can calm down, the inflammation can reduce, your mobility can return, and all of this can happen naturally when you give your body the right support. Hydrating your cells with mineralized water, avoiding harmful movements, and practicing the correct extension exercise form the foundation of true healing. Over time, the disc material gently moves away from the nerve, allowing you to walk, sleep, and bend without that burning electric pain shooting down your leg. You don't need expensive procedures. You don't need constant medication. And you certainly don't need to live in fear. Your spine has not given up on you. It's simply asking for the right kind of care. Be patient with your body. Work with it, not against it. Because when you treat your spine the right way, healing without surgery isn't just possible, it's expected. If you've been living with back pain, sciatica, or a herniated disc, remember this: your body isn't broken. It's just waiting for the right support to start healing again. Small habits like rehydrating your discs, avoiding harmful movements, and practicing the right extension exercises every day can make a life-changing difference. So don't rush into surgery, don't lose hope, and don't ignore what your body is capable of. Healing takes time, but it does happen. And it starts with simple steps you can take right at home. If this helped you, share it with someone you care about. You never know who might need this today. Stay consistent, stay hopeful, and take good care of your spine. Your best days of movement and comfort can still be ahead of you.